Hi, I'm Po-Chih. I was a master's student in National Taiwan University, and I'm here to present our latest work, the Infant Cardiac Robotic Surgical System, or iCROSS. It is designed to assist in cardiac surgery for infants. And as you can see in the video, it can be teleoperated by two joysticks. Currently, we have validated its performance and feasibility, and dry lab experiments are included. The reason why we want to develop this system is that we have seen the success of robotic-assisted procedures in a variety of fields, and it is beneficial for both the patients and the surgeons. For example, the smaller incision can reduce the patient's hospital stay, and it can also provide alternatives for the surgeon, so they don't have to suffer long hours in an awkward position. However, those benefits are restricted from certain patients, such as the infants, mainly due to the physical limitation caused by their small size. Take the Da Vinci surgical system, for example. Dr. Yoshihiro has tried to use this system to apply heart-related surgeries on children. He highlighted that this system cannot apply on patients whose age is 2 years or below due to the size compared with that of the system, which is designed for adults. However, those lives of our little patients are very important as well. Therefore, we hope that by developing this system, we can improve their quality of life. Currently, we focus our applications on the PDA closure surgery, which is related to a congenital heart defect on the ductus. The first reason is that this defect is highly prevalent among premature infants. Another reason is that its surgical procedure requires delicate operation within a very small incision, which is very challenging for the surgeons. There are reported cases in which the patient died during the procedure. Such a requirement for precision is exactly where we can show the biggest strength of our system. This is the design of our system. It has two identical arms, each consisting of two prismatic joints, which are near the base and followed by 4 revolute joints. Its 4-6 degrees of freedom is demonstrated in this video. This spatial design allows the two arms to get very close without collision, which is an important requirement in the surgery. In addition to this, we also made a lot of efforts to reduce the footprint around the end effector, which can further reduce the chance of collision. For example, we adapt a customized worm gear set on the 5th joint, and we also put the actuator for the instruments away from the end effector by using a cable-driven mechanism. As a result, we can operate the system with high dexterity even when the two instruments are very close, which means they can collaborate within a very small incision. As for the system's performance, the teleoperation latency is less than 26 milliseconds, and accuracy is around 2.5 milliseconds, most of which is caused by the kinematic error, and it can be further calibrated if required. On the other hand, the repeatability is around 0.3 millimeters. According to those results, its performance is acceptable in our current applications. On the other hand, to verify the feasibility of performing the PDA closure surgery, we designed 2 dry lab experiments based on a real infant patient who had such a defect. The first task is the dissection task. The goal is to cut off surrounding tissues of the PDA and make it accessible for later procedures. As you can see, this task requires delicate operation, for either those tissues are not cut through or some other organ is damaged, the task will fail. The other task is the ligation task, in which we use the clip applier to close the PDA. If this tool is not aligned with the PDA, the ligation might fail. This misalignment may even damage the ductus, which is very serious because that part is basically part of the heart. Both tasks are conducted 10 times, and our system can finish them within reasonable times and acceptable fail rate. In conclusion, we developed the iCROSS to assist in pediatric cardiac surgeries, while we currently focus on the PDA closure. Its biggest strength is to collaborate within a very small incision, and we have also validated its performance and feasibility. As for the future work, there are two major objectives. On one hand, we are going to add haptic and 3D visual feedbacks on the system, which can improve the quality of teleoperation. On the other hand, we are also going to develop automated procedures using the system. If you would like to learn more details about this research, you can scan the QR code here. And this is the end of my presentation. Thank you for your attention.